Assalamu alaikum. My name is Mahvesh Kadir and my roll number is BP1650134. My group number is 29 and my assignment topic is lower gastrointestinal disorder. My subtopic is irritable bowel syndrome. Irritable bowel syndrome is a condition which affects the large intestine. Large intestine contracts in a rhythmic fashion which is called as peristalsis. But in case of the IBS or irritable bowel syndrome, these contractions become abnormal. In some condition, these peristalsis become so fast that the large intestine cannot get enough time to absorb the water from the nutrients, which leads to watery diarrhea. And in some cases, peristalsis becomes so slow that the large intestine absorb all the water from the nutrients, which leads to hardened stool or constipation. Irritable bowel syndrome is a chronic gastrointestinal disorder that affects the large intestine, causes diarrhea, abdominal pain, cramps, bloating, and gas. Causes of the IBS are abnormal gastrointestinal movement, stress, dietary allergies and food sensitivities, decreased serotonin level, a change in the nervous system communication between GI and brain. Pathophysiology. IBS pathophysiology is not clear. However, certain theories have been proposed, but the exact cause of the IBS is still uncertain. It could be due to the genetics. Post-infections means about 10% of the IBS cases are triggered by an acute gastroenteritis infection. Brain gut access means there will be alteration in communication between the enteric nervous system and central nervous system. IBS, it can be subdivided into IBSD, IBSC, and IBS mixed. IBSD, this type causes abdominal discomfort and diarrhea, means predominant symptom is diarrhea. In IBSC, this type is characterized by abdominal discomforts and constipation, means the predominant symptom is basically constipation. IBS mixed, this type of IBS causes constipation and loose stools followed by abdominal discomfort. So here predominant symptoms are constipation as well as diarrhea. Complications. IBS can cause serious complications, for example, chronic diarrhea and constipation, which can ultimately lead to hemorrhoids. And irritable bowel syndrome is also associated with mood disorders and poor quality of life. The signs and symptoms of IBS can make the patient depressed or anxious. Anxiety and depression can also make the IBS even worse. Irritable bowel syndrome also leads to poor quality of the life. Some patients of IBS cannot even go out to work, school, or engage in their usual routine or hobbies. Symptoms. IBS is usually characterized by pain and cramping, diarrhea, constipation, gas, bloating, food intolerance, anxiety, depression, and difficulty in sleeping. Diagnosis is usually carried out by flexible sigmoidoscopy. This test examines the lower part of the colon sigmoid with the flexible tube sigmoidoscope. Computerized tomography, CT scan produce cross-sectional images of the internal organs, and colonoscopy. In some cases, doctor may perform this diagnostic test in which a small flexible tube is used to examine the entire length of the colon. Management include drugs, antidepressants, antipsychotics, laxatives, and opioid agonists. Dietary modifications include that the person should avoid the food that trigger the symptoms of IBS, such as gases forming food, such as lentils, legumes, and beans. Low fermentable oligo, dimonosaccharide, and polyols may help to improve the short-term digestive symptoms in adults with IBS. Fiber supplementation may improve the symptoms of the constipation and diarrhea. Case study. LK is a 38-year-old woman who has a long history of the abdominal pain and episodic diarrhea. LK works as a sales representative for a major software vendor and is called on periodically to make formal presentations. She develops attacks of abdominal pain and diarrhea. Her past medical history is significant for fibromyalgia, which manifests as chronic tiredness and fatigue. She has undergone an extensive workup, including colonoscopy, upper GI endoscopy with small bowel follow-through, CT abdominal scans, serum electrolytes, thyroid function test, and stool studies. The procedure and test were normal, and LK's gastroenterologist has diagnosed her with IBS. She has bouts of abdominal pain, severity of 7 on a 1 to 10 scale. What pharmacological options are available for LK's abdominal pain and diarrhea? Soap notes. Subjective includes chief complaint. Her chief complaint is abdominal pain and diarrhea. Her age is 38-year-old. Gender is female. Location of the symptoms are basically the gastrointestinal tract. Severity is 7 out of 10 of abdominal pain, and history is basically fibromyalgia. Objectives: her lab test reports, including colonoscopy, upper GI endoscopy, CT abdominal scan, and thyroid function test, are normal. Assessment: gastroenterologist has diagnosed her with IBS according to her symptoms, which were constipation and diarrhea. Plan: pharmacological approaches for the management of the abdominal pain includes the guidelines recommend the use of the tricyclic antidepressants for patients with severe or continuous abdominal pain. Antidepressant drugs amitriptyline is given in the dose of 10 to 25 mg at bedtime, which is quite effective in relieving abdominal pain in patients with IBS. For the management of diarrhea, loperamide is an opioid agonist that penetrates poorly in the central nervous system. It is a preferred agent for the treatment of diarrhea in IBS patients. Loperamide is given in the dose of 2 to 4 mg per oral up to 4 times daily as needed. Non-pharmacological approaches includes food enriched in fiber, increased water intake, and regular physical exercise may benefit in patients suffering from irritable bowel syndrome. Note, many IBS patients who seek medical care suffer from anxiety or depression and benefit from psychological therapies, including cognitive behavioral therapy, hypnotherapy, and dynamic psychotherapy. Although insufficient evidence exists to support the relaxation therapy, some patients will obtain relief of symptoms through relaxation techniques or regular physical exercises. Thank you so much.